Hello everyone, welcome to Legacy As Academy. Yesterday, Indian Council of Medical and Research has come out with a very important document which talks about the incidence of diabetes in India, and this report has been titled as the time bomb called diabetes. So in this particular video, we'll be talking about what is diabetes, what are the cause of diabetes, and what does this particular report talk about with respect to diabetes. And when we talk about diabetes, we have two important types of diabetes, that is type 1 and the type 2. And we'll be looking at what is this type 1 diabetes and what is type 2 diabetes. What is the difference between type 1 and type 2? Okay, so before we continue with this video, I would like to recommend you to subscribe the Legacy As Academy and also hit the bell icon so that you get all the notifications from the Legacy IAS. So let's start. If you look at the context, why are we even talking about the diabetes issue in this particular video? If you look at the context, you can see here the study conducted by the Madras Diabetic Research, an organization, along with ICMR. See, ICMR is really important because ICMR also comes out with a lot of reports which are very important for our exam point of view. So this is a report that has come out along with the collaboration with ICMR, and this report gives very dangerous data about the incidence of obesity and the potential diabetic patients in India. See, it says 11.4% of the India's population out of, if we consider 123 crore, okay, 123 crore as of now, even we don't have a census, our population has been expected to be around 144 crore. So if you look at the marginal numbers of previous 2 years also, if you take the population of around 2020, it just says 11.4% of the India's total population, which will comprise 10 crore people, are suffering from diabetes in India. Just imagine 10 crore people suffering from diabetes in India. See, diabetes is like a slow poison. After you get diabetes, 5 years or 10 years down the line, the body starts reacting to it, and you start losing energy and memory power loses. You will have different comorbidities along with diabetes. That is the reason why diabetes is considered to be a slow poison. Once you get diabetes, it is not a disease. It is not a disease. It is just a way of life. Okay, you will have to change the entire way of life. See, how will it impact the entire country? Okay, you can ask me. There are just 10 crore people suffering from diabetes. How will this affect the entire country? Clear? See, with respect to human geography, we would have studied about a term called as demographic dividend. Demographic dividend. See, demographic dividend is the working age population of one particular country. See, this population, for that matter, let's say working age in the sense 19 years to 59 years. So this age group of people comprising, which are also called as the working age population, are classified under demographic dividend. Why is this important? See, if you look at these people, 19 years to 59 years of age, this is the working age population of a country. If they are working, if this is the working age population, then increasing in the working age population or the demographic dividend will increase the income. If the income in the country has been increased, then this results in increasing in the expenditure. If the expenditure is more, this creates increasing in the aggregate demand. In the economy, you would have studied increasing in the aggregate demand will always give rise to something called as inflation. And why is inflation important? See, inflation is the core for any country's growth. That too, the inflation which is healthy between 3% to 7% or 6%, let's say 3% to 6% is considered to be a healthy inflation, and this is the base for the growth of every economy. So at the end of the day, we can conclude that this working age population, which is also called as demographic dividend, is directly proportional to the country's growth. And if 10 crore people belonging to the working age population, that is demographic dividend, are suffering from diabetes and they are not ensuring their full potential, which means the income drops, the expenditure drops, the aggregate demand drops, the inflation drops, at the end of the day, the growth slows down. Okay, this is why the entire country, the people, the citizens of the entire country being very healthy and being able to realize their full potential is very crucial for the growth of any economy. This is the reason why we are giving it a lot of importance, and we're talking that diabetes is not a good sign. Increasing in the incidence of the diabetes is not a good sign for India's economic growth. Okay. Now, what else does survey say? Survey just says, till now what we have studied is that 10% of the population, which comprises around 11 crore people or 10 crore people, are suffering from diabetes. What else does it say? Look at these numbers. 15.3% of the population, which will comprise 13 crore people, are pre-diabetic, which means they are the potential victims. They are the potential victims of diabetes in the near future. Okay, so as of now we have 10 crore people who are suffering, and we will have 13 more crore people suffering in the near future. This is what we will have to worry about. Okay, so this is what the report says. Now, if you look at why the Indian population are suffering from diabetes, like what happened? This was not the case 15 years or 20 years back. If you just talk to your parents or grandparents, your grandparents didn't even know that there was a disease called diabetes existed. But now what's happening? See, everything boils down to one thing, that is change in the lifestyle. Changes that we have brought about in our lifestyle to make our life smooth and easy are responsible for all these disorders. So if you look at this, instant cereals, junk, fruit flavored drinks, including all our carbonated drinks, Pepsi, Coke, every Sprite, everything included, instant noodles, cup noodles, cookies, ice cream, bakery products, energy bars, everything included. All these have processed sugars in them. Okay, because they have the processed sugars in them, and they are very much dangerous for the health of an individual, and the change in the lifestyle and change in the consumption pattern is leading to the increased incidences of diabetes in the country. A 10% increase in the consumption of ultra processed sugars. If you look at this, 10% increase every day. If you increase the consumption of processed sugars by 10%, and you also increase the risk of getting diabetes by 15%, which means these processed foods and the fast foods, as we can call it as, these are responsible for the increased incidences of diabetes in the country. So you might ask, why don't the government ban all this? See, for the government and for all these corporates, it's the business that runs. But we will have to be very careful in what we are feeding into our body. So what you eat, what you become. So you eat these processed foods, at the end of the day you suffer from diabetes, and if the entire population does the same, then the India's economic growth drops. Clear? So this is what is the reason for it. Now if we talk about two types of diabetes, type 1 and type 2 diabetes, and we are discussing this from the point of your prelims examination, because we have this report that has come out from the ICMR. So high chances where UPSC can pick a question from the differences between the type 1 and the type 2 diabetes, and also can ask you what is the most incidence, like which type of diabetes is more commonly found among the people. See, look at the type 1 diabetes here, T1. The type 1 diabetes is that kind of a diabetes where the pancreas, the function of the pancreas is to produce a enzyme called as insulin. So what will this insulin do? Insulin that is produced from pancreas will carry the sugar from the food that we eat and distribute it to the entire body. All over the body, the distribution of the sugar happens because of insulin. You can consider insulin to be like a transporter. So whatever the food that you consume, insulin takes the sugars from it and transports it throughout the body. Okay, this is the function of insulin, which is produced by pancreas. Now, the type 1 diabetes is that kind of diabetes where the pancreas is not functioning. Okay, the abnormality with respect to pancreas, if it's not functioning, then there is no insulin produced. If there is no insulin produced, the blood sugar level shoots up. This is called as type 1 diabetes. Okay, so this is usually common with respect to young children. Very young children. As of now, you can see children of 10 years, 12 years, 14 years suffering from type 1 diabetes. Okay, this is a very dangerous situation to be in. And you might ask, like, what is the solution to this? So what usually people do is, because pancreas is not functioning and the insulin production has been halted, every day they'll have the insulin injections. They will have to inject insulin into their body so that the body can function properly. Okay, so this is called as type 1 diabetes. Now if you look at type 2 diabetes, see, type 2 diabetes is something that is very common. If you look at your grandparents, the type of diabetes that they are suffering from is called as type 2 diabetes. So what happens in the type 2 diabetes is that the insulin functioning, the functioning of the pancreas, which should produce insulin, reduces. It doesn't stop, but it reduces. Let's say the pancreas was producing 100 ml of insulin every day. 100 ml of insulin we're talking about. But over a period of time, because of the wear and tear, because of the aging, the insulin production has reduced to 60 ml. Okay, so the diabetes caused or the shoot up in the blood sugar level because of this scenario is called as type 2 diabetes. So what happens in type 2 diabetes? What can be done? Two things can be done. Reduce the amount of sugar. This is why for all your grandparents, the doctor would have advised, cut down the consumption of rice, cut down on the consumption of sweet. And even if you are drinking coffee or tea, it should be sugarless. So why? Because we have to reduce the consumption of sugar to match the production of insulin, which is 60 ml. Okay, if you're not doing it, then again, inject the insulin directly into the blood. Okay, so these are some of the solutions. And you can ask me, which diabetes is more detrimental to the life? As we know that the type 1 diabetes is the one, something that you get at a very young age and people have to live with it. So type 1 diabetes is considered to be more dangerous, and type 2 diabetes is a problem of aging. And if you maintain a very healthy diet and you keep on maintaining a very good exercise and a very good physical workout, so maybe getting diabetes is not at all there in the future. No, in order to address these problems, what did the government do to address the problems of diabetes? So government has come up with two important initiatives. That is National Program for Prevention and the Control of Cancer, diabetes, cardiovascular diseases and stroke. So this is one flagship scheme that is run by the central government, and this aims in the reduction of cancer, diabetes, stroke and cardiovascular diseases. World Diabetes Day is observed on 14th November every year. Every year on 14th November, we have the World Diabetes Day, and in order to spread awareness about diabetes and its ill effects to the young people and generation, so that they can take care of their health, they can take care of their physique, they can take care of their diet properly. So we celebrate World Diabetes Day on 14th November just for the purpose of diabetes education. Okay, so this is with respect to type 1, type 2 diabetes, and this is with respect to the report that was published by or along with the consultation of ICMR. So if you have liked the video, hit the like button and subscribe Legacy IAS Academy for more such enriching content. Have a nice day. Thank you.